Welcome to the show, the extraordinary Dr. Isaac Golden.
We know that COVID wasn't all that dangerous.
Yeah.
And eventually, of course, when the vaccines came, they were based on lies.
A lot of the vaccine injured are talking about being shunned by the medical community and not being heard and listened.
And now we see the consequences of so many hundreds of millions of people in all countries around the world being vaccinated with this horrible stuff.
I've even seen hate pages created for people that are trying to speak out. And
Okay.
It's such a pity because so many people have been injured and there's so many died suddenly.
I've had quite a few patients with chronic heart conditions since the vaccine.
And even my partner, he's still having some different side effects that just keep popping up now and again.
Yep.
And there's so many health conditions now that people are going to the doctor for and they don't actually realise it was the COVID vaccine.
And so I've got a standard protocol which I use to detox the different vaccines, Pfizer, AstraZeneca.
Have they cloned you yet in one of those underground cloning facilities? Because we're going to need more of
Clone.
you.
No, there are other very, very good practitioners.
It's important with potentially another pandemic coming and getting the green light that people need to be aware of this stuff. Because ultimately it's about getting together and saying, no, we're not doing this anymore.
We have a dreadful level of chronic disease. Over 81% of all Australians have at least one long-term disease. Prior to COVID, the only time I'd hear from parents was because their children needed help, because they had autism, ADHD, Asperger's, epilepsy, chronic asthma, chronic eczema. Over 40% of Australian children 15 years and under had at least one chronic disease. Yeah, you don't have horns or a pointed tail. Well, I can't tell about the tail.
I definitely don't have a tail.
You've got a tail to tell.
I have a tale to tell, yes. Very passionate about this. In fact, I got trolled this morning.
I'd love to see people learning the truth based on evidence, and we have a huge amount of evidence. If this is the first time you're looking at one of Becca's things, good on you for opening your minds enough to listen and look at options, because that's the only way you can maximise your own health, by taking charge of your health. And the way you do that is through knowledge, not theories, not conspiracies, but facts. And that's all I'm interested in.
Welcome to the show, the extraordinary Dr. Isaac Golden. Thank you so much for being here.
It's a great pleasure, Beck, and I look forward to our chat very much.
Beautiful. Now, this is a fairly controversial topic, so I thought we might start with a bit of a warm and fuzzy question. What are you grateful for at the moment?
I'm really grateful there's a chance Bobby Kennedy might take over control of the health in America, because if he does, he has such a good understanding, such a knowledgeable, evidence-based understanding of why so many countries around the world have massive levels of chronic illness, that something really good, positive might come out of it. Because if it happens in America, it's going to have an impact on every other developed country and a lot of others that aren't around the world. So this morning I felt good. He still hasn't been confirmed, of course.
Right.
Even though Trump's now taken over the presidency. But if he's given a fair hearing in the Senate and he's asked questions, he will have the answers, evidence-based answers. Of course, the pharmaceutical drug cartels won't like the answers, but that shouldn't make the difference. The fact that he speak very, very correctly and with a great deal of authority and facts behind him should get him through. So we'll see what happens. It'll be an interesting year ahead.
Yeah, we were going to come to that later, but we've already started with some of the heavy stuff. So I'm going to bring it back around and sort of have some basic questions about homeopathy before we get into the topic today, which is the vaccines. So, because you're such a legend in the homeopathy field, I've been trying to pronounce that word right for many years.
Homeoprophylaxis.
And that too. I wasn't even going to attempt that word. So if you can explain what that is in simple terms for those that haven't heard anything about it, or they have, but they don't really understand it, that would be a great start before we get into
Okay.
the really heavy stuff.
So homeoprophylaxis was first used by Dr. Samuel Hahnemann, who
Hmm.
founded homeopathy. It was first used in 1799. Vaccines were first used in 1796. So they've both been around for the same amount of time. The word homeoprophylaxis is based around Greek, because
Yeah.
Hahnemann was a Greek scholar, as well as he could speak 7 languages, basically,
Hmm.
and knew how to read the old medical texts. So homeo means similar, like
Okay.
homeostasis, and prophylaxis means prevention. So homeoprophylaxis basically means prevention based on the principle of similars. And homeopathy, the whole area of homeopathy, is based squarely around what we call the law or principle of similars.
Hmm.
Now, even some homeopaths believe that homeopathy should only be used to treat illness. But Hahnemann himself, who founded the discipline, as I said, 1799, he used homeopathic medicines based on the principle of similars to
Hmm.
prevent scarlet fever in Germany at the time. He used the remedy belladonna, which he was at that time using to treat uh, cases of scarlet fever. And then he realized, based on some experience he had, that it could also be used to prevent. It's two sides of the same coin. The coin is the principle of similars.
Yeah.
One side is treatment, the other side is prevention. And Hahnemann spoke very eloquently about, in his essay, The Cure and Prevention of Scarlet Fever, which was published in 1801, he basically said, even though we have in homeopathy a wonderful form of treatment, prevention is better. And
Mm.
that's pretty unambiguous. And I
Mm.
think any reasonable person would accept that. If we could prevent the onset of a disease rather than let the disease start and then treat it, even though the treatment may be very effective, it's much better not to have to do that.
Of
It's
course.
much better if we've got a safe, natural form of prevention. And we have with homeoprophylaxis. And in fact, I'm working on a series of articles that started in 2018, a couple in 2019, one in 2023, and another one coming out in the journal Homeopathic Heritage this year in a few months. And it's working around a database of evidence from 3 countries over about 50 years, mainly by governments and government agencies in those 3 countries, using over 250 million doses of homeopathic medicines to prevent a whole range of different infectious diseases.
Hmm.
So we have a massive evidence base, as well as a history that goes back as far as vaccines. All the evidence suggests we have a level of protection around 90%, which is totally comparable to most vaccines and better than some. But without any risk of toxic damage. A person can't get the disease from taking the remedy. There's no aluminium, formaldehyde, etc., etc., etc. in the remedies, so they're non-toxic. It's a real option, which if only people knew about, and if only health departments in different countries were free of the influence from the pharmaceutical drug cartels, we could use. And
Hmm.
that's not being anti-vaccination. I'm not saying ban vaccination, just like Robert Kennedy has never said ban vaccination. He's just saying, let's look at evidence. He doesn't know probably about homeoprophylaxis, but he's just saying, let's look at the evidence of the safety of vaccines. And when you do look at the evidence, in fact, he and a colleague whose name I always forget, published a book recently, Vaxxed, Unvaxxed, and they, in the book was just full of summaries of research that have been published in mainstream pharmaceutical journals,
Hmm.
showing the difference between people who have been vaccinated with different vaccines and people who hadn't, and their health. It's a very good book. I mean, I'd published a number of the articles they refer to in some of my earlier stuff and in my latest book on vaccine-injured children, but they've expanded the range greatly. And that's what I mean by him knowing the data, knowing the facts. And this is all based on stuff from orthodox medical journals. So the evidence is there that vaccines can cause problems. Now, that doesn't always mean they may not, even though they cause some health issues. The danger from what they're preventing may, in some situations, outweigh the risks. But with the recent COVID experience we've all been through, even though it was stated time and time again that the benefit of these experimental jabs outweighed the risks of the disease, that was simply untrue. And the evidence of that is becoming overwhelmingly available now. And I'm quite sure that even though Joe Biden pardoned Fauci in one of his last things before he left office, they'll still be able to run examinations of what really happened. And Fauci and other people like him who headed the health bureaucracy in America will, even if they can't be prosecuted, they will stand exposed to being liars.
Yes, I believe the truth is going to come out this year.
Absolutely.
And I feel like this is just part of it as well, having you even on, being able to talk about this openly and honestly. And it is going to be confronting for a lot of people. And a lot of the people that have spoken out about this, myself included, we have been silenced and we have been shunned and we've lost family and friends. And all we were doing was just trying to warn them. And so you have all these people that are going to listen to this and they're going to see what's going to happen over the next year or two. And they're going to be shocked. They're going to be angry. They're going to be, I mean, just an array of so many emotions.
Because they're being deliberately misled by people they should have been able to trust.
Yes, exactly. And so we will get into that in a little bit because there's just so much here to unpack with you. I'd just like to go back to what it was that drew you to the industry, because you've been in it for so many years. And so, why did you start working in this space?
Yeah, because originally I was trained in economics and statistics and company finance and all that sort of stuff. And I changed my career path when I was 35, actually, 40 years ago, 41 years ago. And
you look so young. I'm sure it's not that far away, that long ago.
1985, I designed my first homeopathic immunisation program.
Wow.
I started treating vaccine-injured children through referrals in 1986. So, yeah, I've been doing it for a while. Look, when I was an orthodox little economist, I used to vaccinate my own children. One of them was vaccine-injured, and that's what led me to. I had never heard of homeopathy at that time, and some years after that, I decided to change my career path to natural medicine. And even at the beginning of that process, I hadn't heard of homeopathy. And then a friend said, well, you should have a look at it, check it out. And I did. And I immediately resonated. It's like love at first sight. They say it can't happen, but it does. And it was love at first sight for me. And then even when I first started studying it, I was actually living in the bush in Queensland, working as a financial controller for a construction company.
Right.
And I was starting to study and did a couple of little correspondence courses because I wasn't anywhere near colleges in cities. And they didn't talk about any of this either. It wasn't until I got a copy of Dr. Hahnemann's book, Lesser Writings, which is basically a collection of essays that he wrote over his life. And I was reading it, and then all of a sudden there was this essay, The Cure and Prevention of Scarlet Fever, and I was just blown away. And it was like a light bulb went off. And I just knew that if I'd known this when I was a parent making decisions about my children being vaccinated, I would have considered a different option. And after that, I still had a few more children. And it was interesting for me over time to see the difference in the health of the ones that had been vaxxed and the ones that hadn't. So that was very informative when it's that close to home.
Yes.
But that's why in 85 I started, I developed my first HP or homeoprophylaxis program. Just call it HP.
Okay, great. HP, not the computers, but
No, not the computer, HP.
Definitely something that's more powerful.
Homeoprophylaxis, that's easy.
So how are you actually saying homeoprophylaxis?
Homeoprophylaxis.
Prophylaxis,
Homeo
homeoprophylaxis,
similar,
HP.
prophylaxis
We'll just go with
similar.
HP.
Yeah, okay. It's like a condom. It's a prophylactic. It
Yeah.
prevents bad things from happening or unwanted things from happening.
Now you've put a vision in my head and I can't get it out.
Okay. Anyway, now I've lost my complete train of thought. So back then, in 85, my first program was just trying to develop something that would replace the orthodox vaccination schedule at the time, which of course had a third of the vaccines, if not fewer, than what they're doing now.
Yeah.
Now, I've changed that over the years from time to time, and now I'm not even trying to mimic the entire orthodox vaccination program. So I just focus on, in Australia, what I see as the 5 most critical diseases potentially that are actually active in Australia. So it starts with whooping cough, then pneumococcal disease, Haemophilus influenzae type B, meningococcal disease, and tetanus. So for me, they're the top 5. They form part what I call the main program.
Yeah.
And then I have something called the supplementary program with a number of other disease remedies for other diseases in it, which people can use or not. If they wish, they can. If they don't wish, they don't have to. But that other system, that the supplementary program, provides a system of boosters. So, for example, if someone's already had the remedies for whooping cough, but there's an outbreak in their area, or they're going to visit on holiday somewhere where there's a lot of whooping cough, it tells them in the instructions to the program how the whole family, not just the infant or the child, but the parents as well, can use the boosters which are built into the program. And the reason for doing that is that healthy adults can get whooping cough and have symptoms which they don't even consider a whooping cough, but yet they can be exposing the child every day. And with anything, with vaccines as well as HP, if there's constant daily exposure, it's more likely to fail. So if you know that you've got a high level of exposure coming up and you give the boosters, that just improves the odds.
Right.
So it means 90% gets even better.
It just reminds me when I have a son who was diagnosed with all these labels, ADHD, ADD, ODD, all the letters you can think of. And I went on this hunt for help, for articles that will help me. And I came across homeopathy, and there were so many articles that were discrediting it that I didn't actually continue on that journey at that point. Why do you think that is? I mean, I think I know the answer, but I'd love the listeners and viewers to hear what your point of view is on that, because they might be sitting here going, yeah, but I read on this platform that homeopathy is just pseudoscience, or it's woo-woo, it doesn't actually work, it's sugar pills. What would you say to them?
What I'd say is that the answer is very simple, and it comes down to dollars. So the people who run the health systems in the most developed countries, developed in inverted commas, the people who run the mainstream media in these countries like ours, they're beholden financially to the pharmaceutical drug cartels. And if people think, well, that's a load of rubbish, firstly, with the mainstream media, look at how much money is spent on advertising. I mean, it's worse in America. I've only been to America a few times, and watching the local TV, literally every second ad is a pharmaceutical ad. In Australia, it's not as bad as that, thank God. But the amount of the hundreds of millions of dollars that are ploughed into, media companies here show why they are heavily influenced. But even with the best intentioned medical professionals, Harvard University Law School is regarded as one of the most prestigious in the world. And a couple of decades ago, I think it would be now, maybe a decade and a half, they published this whole series of articles, which they had in one of their law journals, on the pharmaceutical drug cartels, their integrity, their lack of integrity, how they influence doctors, medical education, health consumers. You know, these drug companies, they set up, for example, on social media, phony patient groups. So if they're trying to flog something to do with, say, diabetes, they'll set up these bogus patient groups with everyone who says they've got diabetes, and they, oh, isn't this medicine's just wonderful, you know, et cetera, et cetera. Well, that's pretty obvious, okay. But you look at medical education and the amount of money the drug companies put into university education for medical practitioners. And of course, that totally biases the education. And then there's the money that's offered to doctors. Now, that's changing a little bit because it's been exposed over the last 5 or 10 years. But these guys, they ran a survey, or they referred to a survey of doctors, asking the doctors to what extent that does incentives offered by pharmaceutical drug companies affect your prescribing. They'll say, oh, no, you know, they don't affect it at all. And then they actually looked at doctors' prescribing records and things they were suggesting patients do, and they showed that they were totally being affected by the inducements they were getting. And even though they may have genuinely believed that they were still maintaining a level of impartiality, these from Harvard University Law School, they showed quite clearly that they weren't. And it goes on and on and on. And if people want to have a look at it, if you just Google Harvard Law School pharmaceutical corruption, so Harvard Law School pharmaceutical corruption, they have what's called an ethics lab. I forget the actual name. It was named after someone, but it's something or other, ethics lab in the law school. And you'll eventually get to these things. There's about 17 different articles as part of the whole totality of what they did, because they looked at all aspects of this, all aspects of how, you know, people and institutions could become corrupted. And of course, health officials as well. And it's very, very concerning. And unfortunately, I mean, this should be the first lesson in medical school for beginning doctors, showing what Harvard produced, to show them they have to be so careful that their credibility is being brought to question by these immense companies with huge amount of money that effectively control our health systems, as was shown during COVID. If anyone doesn't believe that they do have this control, just go back a few years and look what happened.
Which leads us into the pandemic, or what I call the plandemic.
Yeah.
What were your thoughts? I know we've touched on it a little bit already, but what were your thoughts when it came in? Did you have suspicions? If you could explain what you thought when all that kicked off, I'd love to hear your opinion.
Well, the first thing we heard is that based on flawed data from a guy in England whose name I don't remember, but his data was used. The first thing came in was, this is a really dangerous disease. It's going to kill hundreds of millions of people around the world. Well, we know that COVID wasn't all that dangerous, except for people with a compromised immune system. But it certainly had the potential to kill and cause harm. Then we were told there's nothing that we have to prevent it or treat it. And this is what I'm talking about, February 2020. And that was a lie. In fact, I devised my first COVID homeopathic immunisation in February 2020. And I published an article about it in a free online journal, which anyone who's interested in homeopathy would be worth having a look on. Yes. It's 3 W's, H-pathy, So hpathy.com. Very simple.
I'll put all these links anyway into the show notes.
So 3 W's, hpathy.com. You can still find my article from February or March. They might have published it in March. I wrote it in February.
Didn't it get removed?
No, I don't think so, because they would have had to close down the whole site.
Oh, right, okay. Yeah, because most of these things were getting removed. And
yeah, I know. So we had right from the start something we can use to prevent. Also, right from the start, the CCRH in India, the Central Council for Research in Homeopathy, which is part of the Ministry of Ayush, in other words, an equal ministry to the Ministry of Health, which is effectively the Ministry of Ill Health via pharmaceuticals. They also did an analysis around February, March of the symptoms that were starting to emerge, and they came out with what's called in homeopathy the genus epidemicus remedy. So that's the remedy that's most likely to be useful to treat. You can also use that to prevent, and that was the remedy Arsenicum album. And in fact, Mr. Modi, the Prime Minister of India, took that remedy in very early 2020. Unfortunately, there are so many people in India, they weren't able to cover everyone. But they certainly said that this was something that could be used to prevent. So it was a lie to say there were no methods of prevention. But even outside of homeopathy, people like Professor Ian Brighthope in Australia, who's a wonderful man who was attacked and penalised in a number of ways, but has now lost his registration, but is doing absolutely marvellous work. He has a wonderful, what do you call them, Substack or something like that, is it?
Yes, Substack. In fact,
right, okay.
I've created a website to help put these profiles on for people to help find them, called Yellow
Professor
Heart.
Ian Brighthope. And
Ian Brighthope, I've come across his name quite a few times.
Yeah, he is wonderful, and he's become a real warrior. But he was recommending that way back then, along with a whole lot of other orthomolecular doctors, not homeopaths, doctors, vitamin D. Now, vitamin D is incredibly simple, inexpensive and safe.
Yes.
If people in nursing homes, if the elderly in nursing homes had all been dosed up with vitamin D, it would have saved thousands and thousands of lives. It would have saved enormous suffering. It would have saved the need for their family members to come in, when they were struggling with things. Or preventing, they were prevented from coming in and seeing their elderly. Well, if they'd had this, and I mean, that could have been done by any enlightened either state or federal health department. But of course, we didn't have any enlightened public health officers during COVID. They were all just saying, we've got to wait for the vaccine. We've got to wait for the vaccine. Yeah. And eventually, of course, when the vaccines came, they were based on lies. I remember Pfizer was first touted as being 95% effective. Well, that was simply a lie. And as the months went on, we found it was less than 95. And then we found actually it didn't prevent the disease. And the claim was then made, it stops you going into ICU if you have the disease. And then as the facts kept rolling out from around the world, it showed that it didn't do that either. So, it was just based on lies. And now we see the consequences of so many hundreds of millions of people in all countries around the world being vaccinated with this horrible stuff. And in fact, I've been trying to retire for a while. And so I've stopped seeing new general health patients. I'm still doing immunisation and vaccine injury. That's all I do now. And I'm as busy as I possibly can be.
I bet you are. Have they cloned you yet in one of those underground cloning facilities? Because we're going to need more of you.
No, there are other very, very good practitioners around.
Oh, good. There are some more of you then.
Oh, yeah, absolutely. And, the thing I should point out, Becca, is that there's not just one way to do this. There's a number of different ways you can use HP. I chose to use the Cuban protocol because, I went to Cuba 4 times from 2008 to 2014, worked at the Finlay Institute, which is their vaccine institute. But they were also doing the homeopathic immunizations from there. It's amazing, absolutely incredible.
Yeah.
And they have a particular way of designing homeoprophylaxis remedies involving what we call a mixture of nosodes, or otherwise potencies of similar organisms.
Mm-hmm.
You can get the actual strains that were changing all the time. That would be ideal, but we couldn't. And also a mix of GE remedies like the arsenicum album and other remedies that we use to treat. So I've changed the remedy that I still use 4 or 5 times now, probably. But initially I had to start off with, we didn't have any COVID nosodes or remedies prepared from COVID variants. So I used similar nosodes, like the remedy for tuberculosis and the remedy for flu, because it was a flu-type disease. We knew what some of the well-used treatment remedies were very quickly because of homeopathic doctors over in Europe. You might remember Italy had a dreadful experience, but there was a really dedicated group of homeopathic doctors there treating very successfully people with homeopathy. And this, yet again, made an absolute lie of the claim that there was no treatment. We have to wait for these new drugs to be developed. It was just simply untrue. In America, there was a really good group of orthodox GPs, who were orthomolecular or used nutritional medicine, and they were doing wonderful work, which they managed to get published in various places, using intravenous vitamin C, vitamin D, zinc, iodine, all these sort of natural things. And I remember I was on a chat with a group of these doctors. I was late 2020 or early 21, and he was talking about how at their clinic, when visits were banned, what they were doing, they were treating everyone in the parking lot. So these people were driving up with their cars. They were baring their bottoms and making them available to the doctor, who was then giving them an injected with all this stuff.
That would have been a sight. They could have got arrested for indecent.
Well, they didn't, but they hardly any of their patients with the disease ended up in ICU. I mean, it was like 1 or 2%. So, there were so many options available right from the start, but we were lied to systematically. And I see today, as part of his last act as president, Biden has pardoned Fauci. And, Fauci was criminally involved in a lot of the stuff. He was a dreadful person. And he may no longer go to court, but I hope they'll expose everything he did, because he deserves to be shamed internationally.
He does. It's so hard. I mean, were you silenced at all with your work? And did you have any? Were you silenced with any of your work?
Oh, I never published it.
Right.
I never advertised it. Sorry, okay. I published it, but I never advertised it, because if I advertised anything like that, I could have been, actually during COVID, I could have been jailed by the TGA, because they changed the TGA rule. So not just fined, but people were threatened with jail if they said anything about options. I have never, ever since 1985, I've never advertised for sale my immunisation program, which is why most people don't know about it. So it's word of mouth. It's people maybe seeing my books or hearing about it from other people using it. And that's fine, that's the way of the world. But if I'd advertised it anywhere, I would have been put out of business by the TGA. I mean, when I started, I was investigating, the first couple of years, I was investigated twice by the New South Wales Health Department, twice by the Victorian Health Department, and I'm still under a threat of a $70,000 fine from the TGA if I send immunisation remedies overseas. So I never had
that.
So it's ridiculous.
I mean, I've even seen hate pages created for people that are trying to speak out. I mean, it just runs through everything, doesn't it? And
It
it's
does.
such a pity because so many people have been injured and there's so many died suddenly, and it's a really hard topic. Why do you think people don't want to understand what's really going on? Like, why are they so resistant to knowing the truth, do you think?
Well, one of the good things about COVID is that more people have opened their minds, but it still is a minority. It's not a majority.
Mm-hmm.
But there are many more people now. And to give you an example, prior to COVID, the only time I'd hear from parents with children who needed help was because their children needed help, because they had, autism, ADHD, Asperger's, epilepsy, chronic asthma, chronic eczema, chronic allergies, you name it.
Mm-hmm.
They can be responsible for a myriad of different conditions. Since COVID, a growing number of parents are coming to me and saying, right, we have a child or children who are basically healthy. We think they're fine, but they were vaccinated. And since COVID, we've become more aware about the potential for vaccine injury. We'd just like you to do a detox. So I have a standard detox, particularly for DPT or Infanrix Hexa and MMR. They're the two vaccines that do most of the harm, not exclusively, but the majority. So I've got a standard protocol for that. And when that involves using homeopathic potencies of the vaccines, because you see, if the child has not been affected by the vaccine, they won't react at all. But if you give them a high enough potency or strength of the remedy, if they've been affected by the vaccines, there will be a reaction. Could be good or bad, by the way, but there'll be a noticeable change. And out of that group, I've been keeping data. I need to update it. I've just been so busy. But the last time I took it out about 3 months ago, around about half of all of those children whose parents said they didn't believe they were affected by the vaccines, they were basically healthy, they reacted, which showed that they were affected. And I had parents writing me saying, well, actually, now that I've looked at this, I can see there was an area of my child's health which was not good. But because we saw it every day and it wasn't really drastic, we didn't think anything of it. But now that we've seen this reaction, which has intensified things for a period of time, it doesn't last forever, but it's usually often, 5 or 6 days, something like that. Everyone's different. But once they'd seen the reaction, they realised there was something going on. And I was blown away by this. I mean, this is why we keep statistics, because you find out things you didn't know. I didn't know that. I was expecting maybe 10%, maybe 15%.
Yeah.
Almost 50%. And so I'm going to keep tabs on that if I get time. I'm certainly going to try and make time to do that. I've got hundreds of responses so far. If I can, get 500 to 1,000, then it really is starting to have a bit more statistical weight.
Yeah.
But yeah, that's been a real change for me that I've seen. But it's just been a change which shows the potential for damage that's occurred without people realizing it.
Yeah.
Because the weakness created as a child can be magnified as a person goes through life and has more stress, car accidents, whatever, bad diets, broken marriages, you name it. It just can then bring out weaknesses that have been around for a long time.
I definitely want to get on to the children topic. I do have a couple of questions around that. If we can just maybe circle back to just the COVID thing, so I can just make sure that people are listening can understand what symptoms can you help with?
Okay, so with COVID, there's a number of different things.
Okay.
So one is obvious injury from the COVID vaccines. So that's the majority of people who get in touch with me. And so I've got a standard protocol which I use to detox the different vaccines, Pfizer, AstraZeneca. There are different remedies for the different vaccines.
Okay.
Yeah. And once again, that's based very simply. I love simplicity. So I can do something simply, I'll always choose to do it that way than complicated way. Because the other good thing about that is that if, once again, like I was talking about with the children, if there's a reaction to a potency of a COVID vaccine, you know the vaccine cause problems. So that's the first thing I start with. And for quite a lot of people, that's all they need. In other words, we go through however many potencies they need until they get to a point they can have a high potency, a new one, the next potency up, and there's no reaction. Then you can say with a great deal of confidence, the direct vaccine effect has been cleared. But it's not as simple as that with COVID, with these vaccines, because the COVID vaccines were designed, most of them anyway, to cause our own bodies to become little factories producing spike protein. And spike protein is toxic, whether you get it from the disease or whether you get it from a vaccine. And of course, if you get it from a vaccine, you don't know how long it's going to continue being produced.
Yeah.
So if the first round of issues is not helped by potencies of the vaccines, then sometimes I'll use potencies of the spike protein. And in some cases, that'll finish things off. Occasionally I've started with that if the person has really read a lot about spike proteins and they really want to deal with that first. Okay, that's fine. You can do that. You can do it either way. So treating vaccine injury is the first big thing. Then there's long COVID. And that will depend, of course, whether or not the person's been vaccinated or not, because a huge number of people who've been vaccinated got COVID. That's because the COVID vaccines were really poorly effective. They weren't very effective at all. A bit like the flu vaccine. I mean, the flu vaccine, the worst year I ever saw in government figures, it was 15% effective against the most common strain of the flu. Well, 15%. Why bother? Have some vitamin C and zinc every day. You get much more protection.
Positive mindset and sunshine too.
Yeah, exactly. Well, that's the vitamin D in the sunshine. And that's very true. So, but long COVID, if it's a person who is not vaccinated, then what I use the potencies of some of the strains of COVID, in other words, what we call nosodes in homeopathy. And they usually help. They're very, very good at helping. If the person's got long COVID and they're being vaccinated, then the real question is, what have they got? Is it one or the other? Is it a combination of both? Because there's definitely evidence in orthodox medical journals that if you've been vaccinated and you get COVID, you often can get it worse, not better, worse when it comes to long COVID. But anyway, putting that aside, that treatment will be more complicated because it could involve a range of different remedies. And so it's a matter of dealing with what's needed for that particular person. Then you've got, still with COVID related, you've got people who generally are not vaccinated or have been but aren't doing it anymore, but are still concerned about being affected by the spike protein being shed from other people who have been vaccinated still for COVID. And so that's where there's a wonderful remedy in homeopathy. I call it BUAU, Buthus australis, and it's a potency of scorpion. And it was the most brilliant, and still is the most brilliant remedy. It's first aid treatment for being affected by the spike protein. And in the height of COVID, I used it a few times when I'd been out mixing with other people, and I came back, felt really dreadful, take 2 or 3 doses and it just cleared it away. But there was much more compelling evidence about it than that. I had ladies mainly who were massage therapists who were massaging, while people were being vaccinated for COVID. So you couldn't get more exposure hands-on, the raw flesh. Normally, I would say when people got it, okay, you don't use it most of the time, but if you've been out with a lot of people or whatever and you start feeling dreadful, and it can be at any level, physical, mental or emotional, start taking, 3 doses a day for at least for 1 to 3 days.
Mm-hmm.
And that's usually all that was needed. But these ladies were saying, look, what we've been doing, and I didn't fault them for doing this at all, if we had a big day in the clinic, we just have a dose at the end of the day and we were okay. If we didn't, we'd wake up next morning feeling dreadful. So what they found is that they were still taking it to get rid of the spike protein effect acutely.
Mm-hmm.
But it was a little bit different, but that's great. I mean, I did 2 big surveys, one in 2021, one in 2022 in Australia,
Right.
amongst people using what I was giving out around the country. And the one in 2021 had well over 2,000 respondents. The 2022 one's a lot smaller.
Okay.
Because 2021 was really the height of this.
Mm-hmm.
And people were using some of the remedies quite differently to what I'd recommended. And I learned a lot from that. And that is that people are often smarter than you are when it comes to dealing with their own health. So some of them were using BUAU if they got COVID, even though I'd only said, right, it's really good for treating the effects of the spike protein. There was a percentage of people, and all this has been published, by the way, in Similia, which is the journal of the Australian Homeopathic Association. I published all the data, it's pages of data.
You've been
and I really learned a lesson from that, because it showed me that, okay, they got COVID, and they thought, well, why don't we take it? We've been affected by the spike protein, and a decent percentage of them had good results.
Oh, wow.
Much more than I thought. And things like that, so, and also the remedy that I was using as a preventative, it had a failure rate. And some of the people who had taken it as a preventative then took it as a treatment.
Mm-hmm.
And it had a reasonable percent of success. So you just never know. But it's not surprising in a way with homeopathy, because everything is based around that principle of similars. And all of these remedies had things in common, or things that were similar. And that's almost certainly why they had a much broader application than what I'd considered initially myself. Yeah, so it was very revealing. Was that what you asked me? I can't remember now.
Yeah, you did a great job. I mean, it was such an informative answer. I also like to know that if I have myocarditis or pericarditis or one of the serious health conditions which has come out from the jab, can you help me, or am I too far gone?
No, I mean, it's worth trying.
Right. Okay.
It'll do you no harm to try.
I don't have it, by the way. I didn't have
good.
it.
But no, look, I've had quite a few patients with chronic heart conditions since the vaccine. So no, it's definitely worth doing.
Right.
And, whilst it's hard to get responses from people, I have to email, and even then I don't get responses from everyone who used it, but I certainly have had very good reports. I am trying to keep data, and which is harder than the other data because there's so much of it. But I'm trying to keep data. I published a little bit of early data on this, and certainly heart conditions like pericarditis are among the things that we treat. It's very safe to use these treatments to do that, and it won't make them worse. It can make them potentially a lot better.
Okay, so if anyone does have a side effect that they do know has been impacted by the vaccine, it's still worth exploring all these other options.
Oh, look, people have come to me who are vaccinated in 2021, and they've come to the end of 2024, a few and a half years later, and it still makes
it's still happening, because I've heard that the spike protein just goes around the body or something. And even my partner, he had 2, he's still having some different side effects that just keep popping up now and again. And there's so many health conditions now that people are going to the doctor for, and they don't actually realize it was the COVID vaccine. And I think that's why it's really important to have these types of conversations, to also say, if this is it, don't be looking at a different form of medication that might then create other side effects. And
Yeah.
Then you go down the whole route of polypharmacy, where then you're taking other medications to then, impact the first symptoms and so forth. And so there'll be people out there that don't actually realize they have a vaccine injury.
Yeah. And look, to their credit, a minority of orthodox GPs are telling some people,
They are.
we think this is a vaccine effect.
Okay.
But the
So they have
majority,
started, right.
yeah, the majority aren't, which is a shame. It's like dentists and amalgam fillings. 20, 30 years ago, the dentists felt that if they acknowledged that amalgam fillings were bad for you, people would lose confidence in them. And what they've found, I think, is the ones that didn't acknowledge that amalgam caused problems, they're the ones that people don't have confidence in anymore. But, look, it's such a shame. Science is meant to be open, transparent, and honest. That's what real scientists are like. And we found during COVID that the majority of people who profess to being real scientists aren't. Simple as that.
It's waken a lot of people up, and I guess that's the only plus right now as things keep changing. You mentioned
to be honest with you, I think it's one reason why Trump got elected.
They wanted the information to come out.
Well, people wanted to hear something truthful rather than spin about what had happened to them, not just with vaccines, but with the whole masking. You know why they call them P95 masks? Because they have a 95% reduction in dust particles, in preventing dust particles, because that's when these P95 masks were first being used.
Yeah.
And that's why they got the name. That apparently, and I'm not a person who deals in this area, but I've read it more than once, apparently the size of a COVID virus is 1,000th the size of a dust particle. So when the Cochrane collaboration, who is one of the most highly regarded collaborations or scientific bodies in the world, they do what are called meta-analyses. In other words, looking at a whole lot of similar studies to try and get an even bigger and more reliable picture of what's really happened. They did a meta-analysis on what had been revealed about masks, and they came up with a finding of around about a 15% level of effectiveness. Now, they were then attacked, of course, and I remember seeing a reply some years ago from the head of the collaboration who brought this article out, totally dismantling the attack from some, pharma troll. And so there's evidence that was wrong. And social distancing, there's evidence that didn't help in the majority of situations. I love a game of golf. During COVID, I was not allowed to go as a single person on my own onto a golf course just for a hit in case I caused someone who wasn't there to get COVID. I mean, it was ridiculous because I wasn't vaccinated, so it was ridiculous. So I did, but I didn't go on my own course. I went up to another one and paid, the course fee and just went around on my own. And if I saw someone, they would have been 30 meters away. Hello, there's no risk of COVID outside like that. So, there was so much that was wrong. Interestingly, and sorry, I know I'm getting sidetracked a lot.
No, it's more
there
than
was
welcome.
Something right at the beginning of COVID. I think they brought it out in 2020. It was certainly out by 2021, called the Great Barrington Declaration. I don't know if you've heard of that, but it was done by 3 world respected epidemiologists.
Right.
And they basically said, social distancing and masking is not the way to deal with this particular disease. And they said why. And I remember during COVID on the TV every day, every night, we had these so-called expert epidemiologists in Australia coming out saying all this rubbish, quoting stuff that was just simply untrue. I mean, it just made my blood boil. But the nice thing is, apparently, one of the 3, Dr. Bhattacharya, I think his name is, something like that, he's going to be part of Trump's, team looking at the COVID response.
Mm-hmm.
So that'll be worth hearing, because these guys weren't anything like anti-vaxxers or anything like that. But they just showed that with the information that we actually had about COVID, looking at all of the evidence around the from many other infectious disease outbreaks in the past, masking and social distancing were not required to the extreme level that was done in most countries, and particularly in Victoria, where I live. Fortunately, I don't live in Melbourne.
Good. I found quite a few of those studies that you're mentioning, and yeah, I've put them on the website. So it'd be good for people just to know. I think it's important with potentially another pandemic coming and getting the green light that people need to be aware of this stuff, because ultimately it's about getting together and saying, no, we're not doing this anymore.
Yeah. Well, I think the green light will be a lot more difficult now.
Yes.
There'll be a much higher bar for people to accept if we're told, oh, bird flu is going to kill the world. I mean, in 2009-10, we were threatened with bird flu. Australia spent, I think, $20 million on vaccines for bird flu, and almost all of them were unused because it turned out to be a fizzer. It just didn't become what it was alleged to become. It was a money-making exercise, and it's just a shame we don't have honest politicians who are prepared to think for themselves. There's one or two who do, but the majority don't. They follow what they're told. That's what happened over COVID. In fact, politicians in this country developed as an art form the ability of disavowing responsibility for what they were doing to the health officials. Oh no, the chief health officer said you've got to do this and that. We just have to follow their advice. These are meant to be intelligent people who should be able to read independently. It's not in the mainstream media, but they can access a computer just as anyone else can, and read some evidence from highly respected orthodox medical people. And there was plenty of it if you went looking for it. I mean, Robert Kennedy's Children's Health Defence. Yes. Well, I actually used that all the time during COVID because they were producing factual information, no conspiracy theories, no going down the rabbit hole. It was all evidence-based, and they're still doing it. And that's what I mean. I mean, Kennedy has so much data and information behind him. He'll run rings around any smart politician in America who tries to trick him up with technical questions. I've heard people try to do that, in interviews, and he just makes them look fools because they are.
What an extraordinary man. So you're saying, apart from people like Senator Malcolm Roberts and I think Alex Antic, are you saying that we shouldn't be trusting the government?
Well, I haven't for a long time. I'm a swinging voter. I've never voted the same way all the time. And you might have known that I co-founded the Health Australia Party in 2015.
I was aware, yeah.
We had to close it at the end of last year because it was just too much. We didn't have enough support. We thought that we'd get a lot of support from natural therapists around the country.
Yes.
We got some, but it wasn't nearly enough. But the potential is still there. So the reason why we founded it was to try and give people the opportunity to have someone in parliaments somewhere prepared to talk in favour of natural medicine and point out that a lot of the scurrilous attacks on natural medicine were not based in the truth, on facts, that they were just almost libelous, a lot of them. They were people sounding off who, in the name of science, were totally unscientific. Because natural medicine of all sorts, there's a huge evidence base out there. I mean, I talked about, 250 million doses of HP in those articles, just in limited 3 countries for over 50 years. So there's a lot more evidence than that. But in every form, every modality of natural medicine, there's a lot of really high quality evidence about the effectiveness. Once again, you know, I know I'm sounding like I'm repeating myself a lot, but I'm looking forward to seeing if in America, the efforts to try and make America healthy again prove to be effective, because that will show countries like Australia.
Yes.
This is what you need to do to cut down the level of chronic disease. We have a dreadful level of chronic disease. I mean, over 81% of all Australians have at least one long-term disease. Now, you know, you can define chronic disease somewhat separately, but the Australian Bureau of Statistics used to bring out every 12 years a little summary. They stopped very suspiciously, I think, about 16 or 17 years ago. They stopped doing this. But at the last one that they brought out, it showed that over 40% of Australian children 15 years and under had at least one chronic disease.
Yeah.
Now, if you've got almost, that was 16 years ago, probably 50% now. If you've got that level of percentage with a chronic illness when they're meant to be at the healthiest points of their lives, just about, you know, what's it going to end up? Well, it ends up that the overwhelming majority of people of my age, for example, have at least one chronic disease. And, you know, some of them have multiple chronic, a lot of them have multiple chronic diseases. The health departments and health budgets in these sort of countries, Australia, America, cannot afford this. It's unsustainable, because if it keeps growing, the percentage of money spent on chronic illness is going to become intolerable. You know, and just looking at ASD, autism on its own, I mean, the cost of that on its own is just spiraling out of control in America in particular, but also in Australia. Yeah.
Well, yeah, I do have some questions around that. So before we get into that, I'm conscious of the time, but I hope that you will.
I've got a few more minutes. Yep, I'm looking at the clock too. So we'll get off the conspiracy stuff.
Yeah, well, I just love listening to you.
Stuff.
But you're just so knowledgeable, and you got so much.
Well, it's not conspiracies; it's facts.
Yeah, exactly. Yeah, where are our tin hat things, whatever, the tinfoil hats or something that they talk about? I don't even know what that means, but I'm not even going to Google it.
I think that was with EMF.
Oh, right. Okay. I think they call it for everybody now that has some type of conspiracy theorist. So just wrapping up this section. So let's say I'm vaccine injured, and we're talking about we can do HP. You mentioned earlier that there are other things that people can do, other detox protocols. Can you speak to that just for a moment? Is there anything else that you're aware of that they can go and access?
Look, there's a whole range of naturopathic detox protocols.
Yeah.
You know, and remedies that one can use. So, you know, experienced naturopaths will be able to help people. It's not just homeopaths. I mean, the bottom line is, if a person has health issues and they want to start improving their health, the first thing to do is look at your diet and basically get rid of, as quickly as you can, white flour, white sugar, and heavy fats. And, that will on its own over a period of time make a hell of a difference. But then if you can work with an experienced practitioner, a good practitioner in any modality will be able to help up to a point. Homeopathy can't do everything. Naturopathy can't do it. And no one modality can do everything. So, you know, you might need to seek advice from more than one person over the time. But if you start off with a decent practitioner in whatever modality they're doing, they will guide you. They will start things happening to help. And, you know, I regard my own nutritional knowledge as being very basic. You know, when I hear my wife talking about it, she's a course junkie. She's been a nurse for 30 years.
Sounds like me.
Naturopath for 30 years. And, you know, she'll sprout stuff. I think, oh, yeah, all right. But just refer. So, but even the very basic dietary, nutritional stuff can make an enormous difference. But, you know, you've got to make a decision that it's worth starting. You value your health enough to do something. That's the hard thing. That's the first step, and New Year's resolutions, whatever. Make that decision and you'll get benefit for sure. But you've got to be careful too, because not everyone in the natural medicine industry is as honourable as they should be. There are people who charge outrageous fees and put people on I think, an unsustainable number of supplements and medicines. That's not right. That's not the way to do it. One of the reasons I loved homeopathy right from the start was that the approach was to try and find one, if possible, but maybe 2 or 3 things that would help. And the fact that the medicines themselves are so inexpensive. You are not, well, you shouldn't be charged hundreds and hundreds of dollars just for a box full of medicines when you're leaving a decent homeopath.
Yeah.
So it meant things could be done simply, directly, and affordably. And that's a big factor. And, people talk about cost of living crises. This is a real thing. And so most people can't afford $600 or $700 worth of pills. And you shouldn't need that for most conditions.
Thank you for sharing that insight and wisdom. A lot of the vaccine injured, when I look at their stories on places like Jab Injuries Australia, for instance, who are very vocal for this, the stories are out there, and they're talking about being shunned by the medical community and not being heard and listened. Just to wrap this section off, what message would you give them that we're listening to them?
Well, absolutely. I mean, if they get to hear your podcast, for example, they will hear that there are options available. Now, a lot of them will probably not hear your podcast if they're hooked into the orthodox, medical system. And, Einstein said the definition of insanity was keeping on doing the same thing and expecting a different result. But some people go back to their doctor 10 years in a row doing the same thing.
Yeah.
And I'm not saying doctors are bad. Doctors know things I don't. Doctors can do things I can't. So the best system is where we work together.
Yeah.
And that's what I love about Cuba. The doctors there, they could prescribe drugs if they wanted to. They could prescribe homeopathics, herbs, nutritionals, whatever. Do acupuncture if they wanted to, if they thought that was the best for the patient. And India, they've got the Ministry of Ayush, which is effectively the Ministry of Natural Medicine. And it looks at a whole range of natural medicine. Homeopathy is the H in Ayush, A-Y-U-S-H, and that's homeopathy. So, it's an enlightened system. We could do that here. We could do that here if we had enlightened politicians. But in general, we don't. We're very poorly led on most states, and certainly the federal level. Whether it'll improve, God only knows. I hope it does. But, if enough people inform themselves that there are options, eventually, once they become a big enough minority, they might then move into being a majority. And once they're a majority, they vote, and then the politicians might change.
Yeah, we can always just cross our fingers and our toes.
You're more likely to see it than I am, put it that way. If I see it, that's great for the country.
Are you okay to talk about the children, or do you need to go and we can take this up another time? How are you feeling? Because
it's getting a bit late.
Okay, so we won't touch. I can just wrap up and then because I did have quite a few about the stuff like autism and sudden death syndrome, but it's a whole nother.
It's okay with you if we could do it another time.
Yeah, it's a whole nother topic, and I think that once I get into the film production, maybe then we can have that conversation like on the doco, and I'll come down to Melbourne. And now that you've met me online,
no, you don't have horns or a pointed tail. Well, I can't tell about the tail, but you don't have horns.
I definitely don't have a tail.
You've got a tale to tell.
I have a tale to tell, yes. Very passionate about this. In fact, I got trolled this morning about just speaking out. So
well, in October, last year, my website was attacked and I lost my website and my main email address.
Right.
And we've finally got it back. So maybe it would be good. My website, if people wanted to look up, it used to be homestudy.net. It's now homestudy.au because we had to get a whole new website.
I saw that.
Yeah, it's on the signature.
Yeah, I will put all the links that are relevant to the
well,
podcast
great.
underneath. Okay, well, I'll just wrap up then.
Yeah.
What's just with a couple of questions, just so we can add a nice end to the podcast. So, what is your vision for the future of homeopathy and HP? What would you love to see is going to happen?
Well, I'd love to see people learning the truth based on evidence, and we have a huge amount of evidence. So I don't have an explanation for how it works that will satisfy your average doctor. But what I do have is a huge body of evidence that it does work. I can explain it in terms that the average doctor wouldn't accept, but there's no point doing that. So that's why if anyone looks at my webpage on this, they'll see evidence, 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 because that's what we've got lots of.
Yeah.
And so one day I would hope that some enlightened politicians would actually get to see this and say, well, look, at least let's make this an option. It doesn't have to be you either vaccinate or you use HP, either or. It can be some people can do that and other people can do that, you know. And so even if you reduced the level of vaccination to 50% of what it was now, and the other 50% used HP, the level of protection and therefore the level of infectious disease in the community would not get worse. But what would change would be the reduction in the incidence of chronic diseases in the community. That's what I would love to see. And in fact, I probably shouldn't say this because I'm putting myself in, but this last week, I wrote down the title of the next book I'd really love to write.
Yes.
And it's to do with homeoprophylaxis and a reduction in chronic disease across the world. Because using it sensibly and not in a oppositional way to vaccine, you know, people want to vaccinate, they vaccinate. But give people the truth about both and let them decide. You know, that's what's meant to be happening in medicine, you know, informed choice. And so if people had an informed choice, I know that a huge number would use it, and that would just mean the whole population would be healthier on average than it is now. That's what I would love to see in the future.
And I think it will happen. Is this the book you were talking about that you kindly gifted to me a few years ago?
That is a really old edition of Vaccine
got an updated
Children.
One?
And so it's now in its 4th edition.
Oh, wow. Okay.
So
I'm going to have to get that updated.
Send me your address and I'll pop one in the mail.
I don't expect you to give me
no,
another one.
I'm
I will
happy to
pay
do that.
for it.
No, you don't have to pay for it. You know, you've got to get a few fringe benefits from all the hard work you've done. But no, it's significantly updated from that.
Right. Okay.
Yeah,
beautiful.
So.
And is there anything else you'd like to
share?
That's not
the book I'm talking about.
Oh, right. It's a different book. Well, I can't wait to read your new book.
Oh, well, you might have to wait 3 or 4 years.
That's okay. Maybe our books will come out together because I'm writing on about ADHD and its impact on families. So,
well, the biggest vaccine associated with ADHD is the Infanrix Hexa. It's got a very clear link to ADHD. So, yeah.
Well, that's for another conversation because I know I want to carry this on with you. It's just been such a joy. Is there anything else that you'd like to share with the viewers and listeners before we go?
Just good on you for opening your minds. If this is the first time you're looking at one of Becca's things, good on you for opening your minds enough to listen and look at options, because that's the only way you can maximize your own health, by taking charge of your health. And the way you do that is through knowledge, not theories, not conspiracies, but facts. And that's all I'm interested in.
Beautiful way to end. I love that. Thank you so much for your time and wisdom and sharing everything that you have today. I'm sure there's so many people that are going to benefit from hearing you. And I look forward to meeting you in person, hopefully in
Good.
the next couple of years.
That'd be lovely. Yeah, well, don't leave it too long. The clock's ticking.
Uh, You're fine. You're still using all your remedies and everything. You've got a long life to live.
Okay, thank you.
Thanks so
Lovely to
much.
chat.
Lovely
Bye
to
bye.
chat with you. Bye. Well, thank you again to Dr. Isaac Golden for those amazing insights. We really appreciate it. Thank you to everybody that is still listening. As I mentioned at the beginning of that conversation, I will be playing a video now by Dr. Mike Yeadon. He is what Wikipedia refers to as a British anti-vaccine activist and retired pharmacologist. And apparently in 2020 and 2021, he was making false or unfounded claims about the pandemic and the safety of the vaccines. So that was in 2020 and 2021. And here we are recording in 2025. And he's still talking about them, except this time, I don't think that they can say that anymore. So without further ado, I will play Mike's video for you. So thank you for sticking by, and I'll come back to you right at the end.
Hello, my name is Dr. Mike Yeadon. I'm probably the most qualified former pharmaceutical company research executive in the world speaking out on this matter. Before I talk about the so-called vaccines, there was not a pandemic or a public health emergency. I don't think there was anything at all apart from lies, propaganda, fear-based information, fake diagnostic tests called PCR. Nothing was happening at all apart from medical murder and propaganda from the television and the newspaper, politicians, and many well-known public figures who are doing what they were told. But for me, I think the worst thing, because it comes out of my industry and because it's so deliberate, it required such a lot of forethought, are the so-called vaccines. Now, we were told there was this new infectious disease. So far, so good, ladies and gentlemen. But then they said, don't worry, we'll rustle up a vaccine. And they did so in about 10 months, something like that. I can tell you, after spending a career in this industry, you can no more make a baby in 1 month with 9 women than you can make a complicated biological product in 10 months. It cannot be done. It was not done. They did something else. They created materials which were essentially injected poisons. They were not vaccines. There was never anything to vaccinate against. And I came quickly to the conclusion that they wanted to bring about toxicity that would injure, kill, and reduce fertility. The objective of these so-called gene-based vaccines was to inject you with a genetic sequence for something called spike protein. Now, it doesn't really matter what spike protein is, if it's real, where it came from. The point is, it's a genetic sequence for a protein that doesn't belong in your body. It's non-self, it's foreign. Your immune system is a wonderful work of God and nature. It distinguishes self, things that are meant to be inside you and are fine, from anything else, foreign, non-self. If you inject a person with a genetic sequence that instructs your body to become a factory for some protein that doesn't belong in you, your immune system will detect that and it will attack every cell that's done that instruction and kill it. Now, these materials, when injected in your arm, didn't stay in your arm. They traveled around your heart, your lungs, your kidneys, your brain, your ovaries. And in every place it landed, if it was taken up and expressed, your body registered that as foreign invasion, and it attacked and killed every cell doing it. There are loads of experiments, lots of published experiments showing that proteins like that one cause blood coagulation, damaged nerves, damaged heart tissue. So they injected you with something that would make your body make a protein that doesn't belong there, knowing axiomatically, automatically, unavoidably, your immune system will attack that. So big picture, what happens, I think, from the research I've done, and of course I'm an expert in research and development, not in politics, but I believe that very wealthy people, the kind of people who run foundations with names, have planned, as have their antecedents for a couple of generations, to take over the world, to remove the freedoms of ordinary people like us that they regard as useless eaters. They don't want us around anymore. And their intention is to strip us of our freedoms by persuading us that there are very frightening events occurring in the world and we need them to lead us to safety. They want one world government, they want to deprive you of your liberty, and then I'm afraid I think they will kill us using these injections because they're going to do it again. All over the world, factories to make mRNA-based materials are being thrown up, billions of doses are being made, and if we let them, they will stick them in our arms and people will sicken and die. So those of you who have been injured or bereaved, in my mind, no blame whatsoever attaches to you. How could you know that people you trusted and thought you could trust were lying to you? Well, that you didn't know. But if you let them inject you again, you have no sympathy from me because they have lied to you. You've been injured or killed. And I've explained to you that they're liars and they have attacked us. So this is your time to do what I'm doing, which is to speak out no matter the consequences. I say to you, if you're frightened about what happens if you speak out, you should be absolutely terrified about what's going to happen. I do think these criminals are going to do it again. They're continuing to threaten us with pandemics like bird flu, monkeypox, and so on. It is all nonsense. Stop listening to liars right now, because if you don't, we'll lose our freedom and then our lives. Thank you.
Whoa, after all that, I'm sure you're feeling lots of different emotions. I certainly am. And even though I've been aware of it from the beginning, it still triggers me. And so I can only imagine if you're hearing this for the first time and you have been either vaccine injured or you have had the vaccine, that it can be very confronting for you. Now, there are, I believe, quite a lot of batches that were saline. So just because you've had the COVID vaccine doesn't mean you have the spike protein, doesn't mean you have to be fearful and that you have to freak out and try and get the help that you need, because there are batches of saline, is from what I understand. Now, if you have symptoms that have arose since having it, then yes, get it checked out. Do what you can to remove it. It is possible to remove it. I know there's people out there saying, and they're putting the fear into people saying that once you've got it, you've got it, but it's not true. And I hope that just by listening to Dr. Isaac Golding, you've got a few places that you can go, and I will put all the details of other people and other practices and modalities on the website yellowheart.love, so you have somewhere to go to get the help that you need. So with all of those big emotions, I'm excited to talk to my partner. His name is Mr. Warwick McClelland. He has been a clinical psychologist for over 20 years and seen thousands of clients. And I know you're probably thinking I'm a little bit biased, but he is extraordinary at what he does. And I know that his clients that listen or watch this will attest to that he is able to help many people. And I think it's important with these podcasts that if there are triggering interviews, conversations, if there are triggering things that need addressed, that I don't leave it open for people to wonder how to address the way that they're feeling. So let's welcome Mr. Warwick McClelland. Hello, Warwick. It feels funny me using your name.
Yes, hello, Becca. Fantastic to be here.
It's wonderful to have you. Now, you've seen Mike's video, and there'll be people that have watched that and feeling pretty stressed, angry, lots of different emotions, fear, And I just thought we'd speak to you as a qualified clinical psychologist who can shed some light on, how can they process these big emotions that they're feeling right now?
Well, I think I wanted to point out first that everyone's going to have different reactions to videos like Mike's, depending on their unconscious patternings, their unconscious belief patterns that generally have formed, the core beliefs formed between the ages of 0 and 7. So we are programmed very early on into certain belief patterns that basically mold our personality that will then determine how we automatically respond to different things that happen around us. So some people might respond to Mike's words with disbelief or a sense of denial, and that could be driven by belief patterns such as I need others to feel safe, or I must avoid confrontation, and that can, I guess, blind us from some evidence that's right in front of our eyes and put us in that state of denial. Others might be running from unconscious patterns such as I need to be in control and the world should be just and fair, and understandably be quite angry and indignant around something like that video. So I think it's important to start with that, because comparing yourself to others isn't necessarily helpful in deciding what's an appropriate response to that sort of this sort of controversial, I guess, news. So yeah, that's important to start with, and then from there, acceptance is certainly a key, skill or capacity that we don't automatically default to as humans. We tend to want to control things, and acceptance doesn't necessarily come automatically. So obviously there's the acceptance of the fact that we can't go back in time. We don't have a time machine. We can't change the past. We can't change our choices, other people's choices. So acceptance is something we often have to actively work at. Acceptance isn't the same as resignation. Resignation is more of a giving up and throwing your hands up in the air and I guess feeling somewhat of a victim to circumstances. That's different to acceptance. So acceptance is a big one, and then also applying that kind of acceptance to our emotions. So these waves of emotion that we feel, often we try to resist them, push them down, suppress them, distract ourselves from them, and that's not healthy in the long term. So finding ways to identify that you're feeling something, maybe even track it in the body, sits in your chest, your abdomen, your throat, your head, and acknowledging it, allowing it to sort of surge through you and move through you as energy. And that's certainly a much healthier way to process your emotions and any of the other methods that we can sometimes fall into. Then there's the thinking side. So we can have these emotions, but then still be running certain stories in our minds about why we're justified in having these emotions, or taking us back into the emotions unnecessarily. So being aware that you can't necessarily control whether your mind is going to run different stories and flick back to the past or go to the future or wherever it likes to go, but to know that you can be the observer of those thoughts, which is a skill that I think all children should be taught, to be honest, in schools. One of those skills that, is sadly missing from the way, young people are educated. To learn how to be able to observe your own thinking is a powerful, skill that most of us will have to learn later in life, and realize that thoughts are just words, pictures, images, I guess memories passing through. They don't have to be of the utmost importance, and we don't have to fixate on them. And even if they're true, it doesn't mean they're helpful. That's the biggest thing. Just because a thought is true in your own mind does not mean it's helpful. So fixating on it as if, this is my thought here in my hand and I put all my attention on it because it's true doesn't mean it's helping me. So learning to be a bit more of a detached observer of unhelpful thoughts is a big one. And finally, to support all of that, being able to anchor yourself back into the present moment. Because if these waves of emotion, once we've allowed them to move through us and step back from our thoughts and observe them a bit more, if that's unfolded or that is unfolding, and then what do I do next? Come back to now. Now is where we have our power. Now is where we can take action on our values. So yeah, obviously if there's something that you feel you need to take action on, that you can take action on, that you're able to take action on to align with your values, then sure, take that action. Although if it's, 10 o'clock at night and you can't really do anything about it, then again, back to just parking it and observing it and waiting until you can take action on your values is necessary. But the present moment is where our power lies, and it's also where we can bring ourselves back to states like gratitude, because bringing ourselves back to being grateful for what we do have, even if that can be hard in the midst of the storm of some strong emotions, but bringing ourselves back to, okay, well, this is what I do have in my life right now that I'm grateful for. That's not always possible. There are some times when, you've just got to find your way back to neutral. And that's probably the best you can do. Gratitude can be a bit of a step too far sometimes in these moments. I'm not suggesting that when we're feeling something really strong and intense, find your way to gratitude. Neutrality is probably the best that you can kind of find in those moments, and just observe and witness it and let it pass through you. But after that, finding your way to gratitude can also be very helpful and powerful.
And can that be for any type of emotion that you're experiencing? Because I know obviously you've got the spectrum. Are you saying that those handy tips are for any type of emotion?
Yeah, I would say so. I think if you look at different types of emotions, they cycle through us a bit differently. So if you think about anger can be a really sharp spike, if you like, goes up quickly, is intense, makes us want to sometimes act really quickly, throw something, yell, that kind of behavior can come with a surge of anger. So that can be one of the most challenging ones to ride your way through, because anger can catch us really quickly, and before we know it, we're, acting out. So to be able to catch the anger really early on as it starts to spike and just feel it surge through us, it might feel like a pressure in the head or a heat wave going through the body or something like that. But yeah, definitely all that I said just a moment ago applies to anger. Anxiety would be the same, maybe a bit less intense anxiety. It can be more of a wave that comes and goes, but over a steadier period of time. It can linger for a while. Anxiety, as far as the peak of the wave, could still sit with you for a good half an hour or something like that. But yeah, those types of emotions, and grief, and the majority of the emotions applying this kind of an approach to, I think, works really well. Something like a sadness or a depressed kind of an emotion. The biggest challenge with that is, allow yourself to feel it and don't deny that you're feeling flat or sad. But the biggest danger, I think, with something like a sadness or a depression is that you sink into it too much. The thoughts kind of keep you in it for longer than what you need to stay in it, and you stop being active. You withdraw too much, and you pull away from exercise or work or whatever, and with something like a sadness or depression, it's very important to stay active and to keep moving, to keep taking the actions that either you need to take or that lift you up, even though they might not feel as enjoyable in the midst of a wave of sadness or depression.
What about practical things? So if you're feeling angry and you want to write a letter to the government, to somebody that, you're just so angry at, but they've allowed this to happen. And would you say that's a good thing to do, or just wait for your emotions to calm down?
Yeah, look, I think with something like writing a letter in the midst of anger, you can do a draft and really let it all out there. And that can be very healthy to express. But yeah, as far as actually actioning it, I'd always recommend waiting until you're in a much more of a neutral space and the waves of emotion that have settled, and then review it. Maybe it turns into more of an assertive letter with still some, you know, some power and strength in it, of course, but yeah, not necessarily actioning something like that in the midst of the emotion.
And what about people that are feeling guilty? So, for instance, parents who have, vaccinated their children, and they're going to be listening to this, and if they do believe it, they're going to be feeling that guilt. Oh no, what if my child has a fertility issue, and they wouldn't know until they were older? How do parents process the guilt, for example?
Yeah, it's a tough one. I think coming back to acceptance is a starting point, accepting that the action was taken, and it wasn't taken, though, from the point of view of not caring about your child. That's a very important thing to reframe, because if you just take it as in a very black and white way, I did something to my child that harmed them, I'm a bad parent. That's a very narrow story that you're telling yourself about what's happened. No, you haven't. You've done something based on what knowledge or awareness you had at the time, and you thought you were acting in the best interest of your child, and that's it. That the intention was good. So if the intention was good, then that, a bit of reframing can certainly help you not attach to a story that's really negative and I'm bad and I've, really stuffed up here.
Yeah. Parental guilt needs to just be thrown in the trash because we're only doing the best that we can do based on the knowledge that we have at the time. Yeah. And so many people didn't have the right informed consent, they didn't have the right information, and they were just doing what they think was good. So I think that's a really good point. Anything else that we can share with the viewers and the listeners before we go? And what you've shared is obviously very important, but is there anything else that you'd like to share before we go?
Well, if you're still really struggling and seek to apply some of those skills that I've suggested around acceptance, observing the thoughts, coming back to the present, and taking action in line with your values, and it still feels like you're pretty stuck, then, as I alluded to at the start, it can be a case that you've got a part of you that's been unconsciously programmed that's really kind of stuck on what's happened, and I work with a model called internal family systems, which I think is really amazing for being able to delve into it on a deeper level to what is going on with these parts of your personality and that are kind of keeping you stuck. So there are plenty of therapists out there that are working with IFS these days,
but you're the best. I'm not biased at all. I will put your link at the bottom of the
I won't say I'm the best. I love the model. I think it works amazingly, and I get some amazing results from it. So, but I appreciate the praise. My love. Thank you.
Always. So a massive thank you to Warwick. I hope that has really helped you with some tips and ways to help deal with these big emotions that you may be feeling. I'm not going to assume that you're all feeling different emotions. Some of you may be feeling relieved this is out there. Some of you may be feeling happy that we've brought this to the attention on this podcast. And it really depends on which state that you choose to be in ultimately. Can you live in hope and love, or will you be living in fear and anger? You can choose. Now, before you go, you remember in the intro that I was reading out Dr. Isaac Golden's bio, and I didn't know what LMH stood for because I hadn't copied that across to that document. So I just wanted to say it does stand for Liga Medicorum Homeopathica Internationalis. I hope I pronounced that right, Dr. Golden. Don't you just love his name? I love Dr. Golden. And so yes, he is phenomenal, as you would have seen, and I'm just so grateful to him, to Warwick, to everyone that is watching and listening and that can share this in the spirit that it's done. And I will look forward to bringing you another solution in episode 6 by an extraordinary powerhouse woman, Gail Lynn, who has invented the harmonic egg. If you haven't heard about it, you can Google it in the meantime. Otherwise, you can just wait for that conversation. And it's really empowering for me to bring you solutions when there's been so much damage occurred. So thank you again for being here. I appreciate it very much. And I will chat to you very, very soon. Much love from my soul to your soul. Bye.